Hi, I'm Markus Thunecke. I'm a co-founder and senior partner at Catenion. Catenion is a science-driven strategy consulting firm with an exclusive focus on the biopharma industry. We started systematically analyzing R&D productivity of pharma companies about 10 years ago because good perspectives on this topic, going beyond counting total spending divided by approvals, was simply not available. As every year, we have assessed the R&D productivity of pharmaceutical companies now covering the 2023 to 2024 period. Despite a challenging global environment for investment and growth, the overall R&D productivity of the 30 largest public bio companies has increased by approximately 35%. But what is behind this increase? Well, it is mostly driven by ultra-strong performances of the top 5 companies versus the rest, which is a reflection of an increasing performance divide. In addition, there has been a clear impact of megatrends. Obesity has become the industry's biggest NPV gainer, followed by oncology. Within oncology, we have microtrends driving valuations such as development progress with antibody-drug conjugates, bispecific T-cell engagers, neoantigen-based mRNA vaccination, or the CDK4/6 class. Looking at the R&D productivity and corporate growth ranking of the top 30 companies, once again Novo Nordisk has taken the #1 position for the 2023 to 24 period, not surprising given its strength in obesity. With a market cap of 450 billion, matching Denmark's entire economy, Novo will have to achieve significant growth in the coming years to satisfy investors' expectations. Vertex Pharmaceuticals ranks #2, whose valuation is still largely driven by its cystic fibrosis franchise, with 75% of its value from this area. Its blockbuster Trikafta does not lose exclusivity before 2037, but sales are expected to shift to the new drug Vanzacaftor. Vertex is also expanding its portfolio with Casgevy, a CRISPR-Cas9 product for sickle cell disease. With steady growth and 125 billion market cap, Vertex is now a major biopharma player across various diseases. Eli Lilly ranks #3 in R&D productivity and in company performance. With a market cap of 817 billion, it could become the first pharma company to hit 1 trillion. Its key driver is the incretin tirzepatide that stands for around 25% of portfolio value in diabetes, obesity, and potential future indications. Lilly continues to make strategic acquisitions with notable 2023 deals, including DICE for its oral IL-17 inhibitor and protein-protein interaction platform, and Versanis to support its obesity strategy. Despite declining COVID-19 sales, Moderna and BioNTech remain in the top 10 of the R&D productivity ranking, at numbers 4 and 6 respectively. Though both succeeded with mRNA COVID vaccines, their strategies differ. Moderna focuses on expanding mRNA into other therapeutic areas, particularly infectious diseases, with the second mRNA product, Mresvia, approved for RSV. It is also branching into cardiovascular and oncology, reporting positive data in metastatic melanoma. BioNTech, on the other hand, is shifting back to oncology, using COVID profits to diversify into monoclonal antibodies, bispecifics, and ADCs. Both companies face high uncertainty regarding the future value of their COVID franchises, which could significantly impact their valuations going forward. Confidence in Moderna was most recently shattered by announcing significant reductions in R&D spending and number of pipeline programs, and also a reduced 2025 sales outlook. It's likely that both companies will soon drop out of our top 30 ranking with further declining sales. Daiichi Sankyo and AstraZeneca continue their success with Enhertu and their ADC platform collaboration that could produce another blockbuster with the anti-TROP2 ADC currently at the filing stage. Daiichi's platform has elevated it into the top 5, leading to a new ADC deal with Merck & Co., though its lead drug, patritumab deruxtecan, recently faced FDA rejection due to manufacturing issues. ADCs have revolutionized oncology, shifting focus from immuno-oncology back to targeted oncology. J&J's acquisition of Ambrx and Genmab's acquisition of Profound Bio are two recent M&A examples in this field. Absent from the top 10 since 2019, Regeneron and Amgen have made strong comebacks, ranking number 8 and number 9 in R&D productivity, with Regeneron also achieving a 100 billion market cap. Regeneron has regained momentum through its bispecific antibodies in oncology and immunology, while effectively managing the life cycle of blockbuster drugs Dupixent and Eylea. Amgen's success is also driven by bispecific antibodies securing approval for Imdelltra in lung cancer and acquiring Horizon Therapeutics, adding Tepezza to its portfolio. Currently, Amgen's biggest value driver remains the anti-TSLP Tezspire, approved in asthma and developed together with AstraZeneca. Both companies are now targeting the obesity market with novel approaches to challenge leaders like Novo and Lilly. Last but not least, Jazz Pharmaceuticals has entered for the first time the pool of the biggest 30 biopharma companies by sales, ranking number 10 in R&D productivity and number 7 in company performance, due to the commercial success of its narcolepsy and rare epilepsy drugs Xywav and Epidiolex. Whether Jazz can establish itself among the biggest biopharma companies and maintain a top position will depend on continued R&D success and diversification. Now, looking at mid-sized companies with sales ranked between 31 and 50, there are multiple new entrants to the top 10. 2 of the top 5 companies are driven by strong CNS franchises, Alnylam Pharmaceuticals and Neurocrine Biosciences, and 3 companies combine antibody modalities with a strong oncology focus, Genmab, BeiGene, and Jiangsu Hengrui. Alnylam, a new entrant, has quickly risen to the number 1 spot in R&D productivity. Its RNA interference platform has produced several blockbuster RNAi therapies across various areas, partnered with major pharma companies. For example, Leqvio, a PCSK9 siRNA drug partnered with Novartis, saw a huge increase in value versus last year. Alnylam also continues lifecycle management of Amvuttra, approved for familial amyloid polyneuropathy, with a recent phase 3 success also in ATTR-CM in partnership with Sanofi. So what can we observe from the recent developments in the pharma industry? Biopharma often follows a herd mentality when investing in new science and technology. The industry's hype cycle shows how a technology can incubate in academia for years, which is then followed by a trigger event such as a major deal or breakthrough clinical data, which then leads to a surge in valuations and a fear of missing out. In this cycle, often only a few companies are able to reap large rewards, and several marginally or undifferentiated followers will struggle. Current areas affected by this hype cycle include obesity, artificial intelligence, antibody-drug conjugates, and the search for the next big pipeline in a product immunology drug. For many late entrants, the challenge is meeting sky-high expectations that are built into valuations and deal terms, and achieving meaningful differentiation will become crucial for long-term success. At Catenion, we've been supporting our clients to design better innovation strategies and implement powerful portfolio management approaches for more than 20 years. Read our full report on our website, and if you'd like to discuss this topic further, please feel free to contact us.